I think this meeting's been very important, and the kind of in-depth research that happens is really starting to inform clinical practice. So there's a lot of excitement, I would say, around the bispecific antibodies and the anti-BCMA agents, and how we're going to use those agents to increase the depth of response for patients, as well as keeping them safe. And so you can start to see a number of strategies coming along. So weekly injections to get the maximum response, perhaps back off a little, and then monthly maintenance, rather than like one weekly treatment forever and a day, which is clearly going to be unacceptable for patients. So I think that sort of in-depth research informing patient management decisions is like something very important. The other big area here is to see some of these randomized trials report. And it turns out that the survival at 4 years, 3 or 4 years, is now so very high with a 4-drug regimen that includes an anti-CD38 that it's like very exciting for patients, in that most people are doing extraordinarily well with a quadruplet therapy. The issue is, going forward, when survivals are that good, how do we bring new agents to the upfront setting so that we keep this momentum of progress going? So if you could use different endpoints, so instead of progression-free survival, if you could use depth of response and markers of depth of response, then we'd be able to keep the momentum going, because we'd get a result in a couple of years rather than having to wait for 5-10 years to see the benefit of new treatments. So these kind of approaches are really changing clinical practice, and it's certainly a golden age for myeloma patients, where they're now living a long time with good qualities of life and few side effects.